844 at 55 KRCD Talk Station. Happy Tuesday. Great day to be tuned in. Perfect time to be tuned in. You probably have been impacted by cancer some way, shape, or form. I don't think everybody knows somebody who's having to deal with cancer. And my listeners all know that I'm dealing with lymphoma, and my doctors are OHC. So happy to be in their hands. They provided wonderful care and treatment for me over the years. And I feel, well, I'm always uplifted and positive to talk to the doctors from OHC because they're always giving me good news about new treatment protocols and exciting things that are happening, and most notably in the area of clinical trials. And they're really big. They're doing clinical trials all the time at OHC. To learn more or get a second opinion, their phone number is 888-649-4800. You can find them online at ohcare.com. And I'm pleased to have in studio Dr. Jayadev Mettu to talk about the clinical trials. Dr. Mettu is a medical oncologist and hematologist. Good to have you in the studio, Doctor.
Good morning. Thank you for having me.
Got exciting news for my listening audience today, I bet. Clinical trials. That's the way it's... Now, I always like to establish that when you're in a clinical trial, and I've heard this before, so I don't think I'm going to say something that's not right here. You're not like a lab rat. You're not. This isn't just some brand new out of the gate. We're going to use you as to experiment on kind of thing, right?
Absolutely not. So, for the most part, when people participate in clinical trials, people are randomized to either the standard of care, and most clinical trials, the goal for that is to improve on the standard of care. So a lot of times you have people who are going to get what would be recommended by the NCCN or National Comprehensive Cancer Network, and on the clinical trial arm is typically an investigational agent which is hoping to improve on that.
Okay, so the treatment I got, Rituxan. Sitting there, I get a drip bag, and that's what I got. A clinical trial would be Rituxan, which is the standard of care for the lymphoma, plus another drug.
Typically, yes, or sometimes a completely new drug altogether.
Oh, really?
Which would be compared against Rituxan, for example, to try and improve or better Rituxan.
Okay, fair enough. That makes sense. So the benefits of being in a clinical trial specifically?
So plenty of benefits like we just mentioned. Receiving cutting-edge care, often not available anywhere else. Typically, when you're on a trial, there's a very stringent schedule. So you get extra labs, imaging, and that could put you at peace of mind. And at the end of the day, the whole goal is to advance research and help someone else down the line. So participating in a clinical trial is the way medicine will advance and hopefully help someone.
Help and save the world, one clinical trial at a time. And how does OHC handle cancer research for their cancer patients?
So any person who walks through the door and has a cancer diagnosis is typically screened for clinical trials. We educate our patients on the availability of their trials, whether they'd be eligible or not, and what are the benefits and risks associated with that. And that's how we talk to them about the trials and see if they qualify for them.
Qualify, and then in a form of informed consent. By giving them all the information, they have the option of like, okay, yes, that sounds like a good idea for me, or no, I want to go with just the plain old standard of care treatment.
Absolutely.
Great. Now, this is where we get to the good part. What are the newest trials that people need to know about that are going on there, these cutting-edge treatments?
So just a few examples. We have the Flamingo breast cancer vaccine trial.
Flamingo?
Yes, after the bird, correct.
How did he get that name?
You should ask the trial investigators.
All right.
We have what's called an Alpha-3 trial, or to check for minimal residual disease and cancer cells. We have multiple BiTE therapy trials and CAR T-cell trials. But what's important to note is OHC is associated with Sarah Research Institute. So that, by virtue, gives us access to actually hundreds of trials across the network. And based on the screening process we just talked, we can actually start even a single patient on one of those trials if they need to.
Oh, no kidding. Huh. You're consolidating the data with other single individuals out there and around that are doing the same protocol.
Correct. So for the most part, these are multinational trials across the globe. Depends upon how advanced the agent is and how many patients they're looking to accrue. but it can be all across America and sometimes all across the world where they're trying to accrue patients for these trials.
So that's a really interesting component, because it seems like often medicine is a closed, you don't want to share what the information is. You want to be the only one in the block that has this specific treatment, because, of course, that benefits you from a profit standpoint. But you're sharing all this collective data with everybody else.
Absolutely, yes.
Well, that's a wonderful concept. Now, I got to go back to this alpha 3 MRD test to check for residual cancer cells. Is that sort of like after you've been through treatment, you might have cancer still floating around in your body?
Correct. So basically, we're looking for cancer DNA specifically, and we've advanced in testing to be able to actually pick that up.
Okay, because that may lead to the cancer reoccurring.
Possibly, yes.
Okay, all right. And I got to go back to what's the Flamingo breast cancer vaccine trial? How is this a different treatment protocol, and does it work for later stage breast cancer?
So it's actually in patients who've already been treated for breast cancer and doing well. And this is compared to observation. And from the data we have, at least at this time being, patients on the trial are doing better, but more to come.
All right. And then CAR-T, that's sort of the designer, like they check your genetics and they create an agent that targets your specific type of cancer in your body. Have I got that right? I've heard a lot about these over the years, and sometimes I get the different types of treatments.
So briefly speaking, we actually harvest a patient's own T cells. Then those actually go to a lab. They're modified to target the cancer cells. And after that, we reinfuse the patient's own T cells to fight the cancer.
Is that a long process to do that?
It can be a few weeks.
Oh, weeks.
Yes. That's one of the things that they're looking to improve on, is the time between harvesting and giving to patients the treatment.
But, in the grand scheme of things, weeks is not that long if you're getting this tailored drug or tailored treatment. And the results have been, from what I understand, pretty astounding.
Yes.
Well, that's good news right there. Why should everybody care about clinical trials for cancer?
Because of the prevalence of cancer, everyone will at some point encounter it, whether it's themselves, their parents, their family members, a friend, or maybe even a coworker. So it's important that they know what their options are for treatment. And one of those options includes clinical trials. And it should be an automatic step to research what trials are available, and also at OHC as well. That's just a part of how we provide care to our patients.
All right. Well, you obviously save lives at OHC, and I think that has got to be a real inspiration for you to come to work every day, because I've been in the treatment room for my bag, and it is a quite depressing environment, sir. And I always looked around me and I thought, you know what? I think I probably hit the lottery of cancers, given that it's lymphoma. I don't have to worry about metastasization. And I look across the room and I see some poor woman there getting 4 different bags. She's lost her hair because of the radiation treatment. And it's sad to see. I know you're doing great work there, but boy, that's got to be a tough thing. Get up and go to bed when you know you're dealing with death.
Yeah, absolutely. It's not easy. No matter how long you do it, it never gets easy to give a patient like a terminal diagnosis and things on those lines. But that's kind of the whole goal of research, right? Eventually, our goal is to kind of beat cancer.
And put yourself out of business. Well,
I wouldn't be unhappy about that.
No, yeah, see, I knew you were going to say that, because you're smart. You're obviously a brilliant doctor, and you'll find something else to do if you cure cancer. So, yeah, that's A-okay with me. I think that's wonderful. Okay, well, I'll tell you what, it's been a fascinating conversation on clinical trials with Dr. Jayadev Mettu, one of the excellent doctors at OHC. And do me a favor, tell Dr. Patel that Brian said hi. And if you run into Waterhouse, tell Dr. Waterhouse Brian said hi, too. Those are wonderful, wonderful folks. So if you need a second opinion, if you've got cancer and you're concerned about the level of care you're getting, maybe you want to look into one of these clinical trials. OHC is doing them all the time. It's 888-649-4800, 888-649-4800, online ohcare.com.